All right, today we're diving into a question that's, well, it can get complicated and pretty personal. It's something I think a lot of us have probably wondered about at some point.
So here it is. When exactly does drinking cross that invisible line? From just a social habit or a way to unwind after a long week into something that's actually a problem? For most people, that line can feel super blurry. But it turns out, from a clinical standpoint, the definition is a lot clearer than you might think.
And that clinical answer has a name: alcohol use disorder, or AUD for short. And that phrase right there, clinically significant impairment or distress, is absolutely key. See, it's not just about how much you drink, it's really about the impact that drinking is having on your life. So, okay, how do doctors actually measure that impact?
So what's the magic number? What's the threshold? Well, according to the official diagnostic manual, the DSM-5, it's this: 2. That's it, just 2. If you meet just 2 out of a list of 11 specific criteria in a single year, that's enough for a diagnosis of mild alcohol use disorder, and it scales up from there. 4 to 5 criteria, that's considered moderate. 6 or more, that's severe.
And when you look at what those criteria actually are, you can see they cover a whole range of experiences. We're talking about things like, drinking more than you meant to or for longer than you planned, or trying to cut down but you just can't seem to do it. Experiencing really strong cravings is another one. And a huge red flag is when you keep drinking, even when it's causing real problems in your relationships. And then, of course, there are the more physical signs, like building up a tolerance or going through withdrawal. It really shows you that this is a super complex condition, not just some simple matter of willpower.
Okay, so that's the clinical side of things. But how many people are we actually talking about here? Let's zoom out and take a look at the global picture to really get a sense of the scale of this problem.
Worldwide, about 1% of the population meets the criteria for alcohol use disorder. Now, 1% might not sound like a huge number at first, but when you think about it globally, that means we're talking about tens of millions of people.
And if you look at who is affected, the breakdown is pretty striking. There's a really significant gender gap. About 3/4 of all cases, yes, 75%, occur in males.
And if we drill down even further into the data, we see the highest rates are concentrated in one specific age group: people between 15 and 49 years old. This suggests the disorder often starts to develop when people are in their younger adult years and can continue right on through middle age.
And the consequences, well, they can be absolutely devastating. Alcohol use disorder is a contributing factor in 6% of all deaths globally. That's just a staggering number. And it's not just from the obvious health risks like liver disease. It also comes from things like accidents and, sadly, suicide. It just goes to show you how wide-ranging the dangers really are.
So, we've seen how big this problem is on a global scale. Now let's bring it back down to the individual level. How do doctors and other healthcare professionals actually figure out if a patient has AUD?
Well, they have a really clever and structured tool for this, developed by the World Health Organization. It's called the audit. It's actually a tiered approach, which is pretty smart. It all starts with just 3 quick questions about consumption. That's called the Audit C. If someone's score on that is 5 or higher, then they move on to the full 10-question test. And if the final score on that is 8 or more, that's a strong indicator of a probable case of AUD. It's a really powerful way to screen people, even in a regular doctor's office.
All right, so let's say AUD has been identified. What happens next? What can actually be done about it? Let's take a look at the different pathways for managing the condition.
Generally, the most effective treatments combine 2 main approaches. Think of it like a 1-2 punch. On one side, you have psychosocial interventions. This includes things like cognitive behavioral therapy, or CBT, which helps people change their whole way of thinking about alcohol. On the other side, you've got medications. Something like naltrexone, for example, can help cut down cravings by blocking the pleasurable effects of alcohol. The best plan is always personalized for the individual, and it very often involves a combination of both.
So here's the thing. We have these effective treatments. They exist, they work. But that brings us to our final, and maybe the most critical challenge of all.
And that challenge is this number: fewer than 14%. That's the tiny, tiny fraction of people with AUD across the globe who actually get any kind of specialized care. This huge disconnect is what's known as the treatment gap.
So how do we fix this? What's the solution? Well, the research actually points to a pretty clear path forward. As this quote highlights, it really boils down to 2 things. First, we need to make screening a routine part of primary care, just like getting your blood pressure checked. And second, we have to expand services that are culturally appropriate and easy for people to actually access.
And that leaves us with this final, really important question to think about. We know what alcohol use disorder is. We know how to spot it. We have treatments that work. So the biggest hurdle we face isn't really a medical one. It's logistical, it's societal. How do we, all of us, close that massive gap between diagnosis and care for the tens of millions of people who desperately need it?